Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the blog post regarding heart damage and the either childhood pediatric patient survivor or the AYA adolescent young adult survivor. First and foremost, I don't necessarily see anything special about the age of the patient when he or she undergoes aggressive toxicity. What I mean by that is I was technically an AYA patient myself, though at 34, I was pretty old as AYA patients go. The issue is how long have you lived since you've undergone high-dose aggressive therapy. Pediatric patients, AYA patients, generally speaking, undergo aggressive therapies, especially for blood cancers, leukemias, lymphomas. In my experience, my research, it is that aggressive therapy that causes damage. In this case, heart damage, certainly for me, was a long-term, some call it late-stage side effects. In other words, you live problem-free for 10, 15, sometimes 20 years, then bang, your heart damage rears its ugly head. In my case, woke up one December morning in 2010. I had flipped into chronic AFib, atrial fibrillation. Went to the doctor, chemotherapy-induced cardiomyopathy was the diagnosis. And in fact, there are a host of identified problems to my heart. I believe this does and can happen. Studies show there has been damage, heart damage in particular, done to pediatric AYA cancer patients. Some who've identified the heart damage, some I believe are in effect ticking time bombs. Research shows the biological, the damage to our cells by high-dose aggressive chemotherapy. The heart, kidney, bones, muscles. Living with aggressive therapy in your past oftentimes means the patient exhibits frailty, brain damage, chemobrain, heart damage, etc. I don't want to paint just a negative picture. All I'm saying is the aggressive chemotherapy causes serious long-term side effects, serious long-term damage. Damage that you might not see for years. It might not exhibit itself, especially if you're young. If you're 10, 15, 20, you don't exhibit problems for a while. You're young, your body is relatively resilient. In my case, as I say, it was 15 years before I flipped into cardiomyopathy. In my experience, and again, the research is thin about this, but there are a number of non-conventional therapies, nutrition, supplementation, lifestyle, shown to help heart health. In my case, 5 years ago, I began undergoing annual echocardiograms to keep an eye on my cardiomyopathy, my AFib, my heart valves, those kinds of things. And in fact, all of the problems have stabilized. Some have even improved. My ejection fraction, as an example, went from 35, now it's up to 55. All with non-toxic, evidence-based, non-toxic therapies. Long story short, if you have undergone years ago a lot of aggressive therapies, if you have experienced heart damage, or if you are worried about your future risk of heart damage, and you'd like to learn more about supplementation, nutrition, lifestyle therapies, feel free, scroll down, send me an email, question, comment. I will reply to you ASAP. Thank you for your time, attention. Hang in there.